Welcome to another episode of Startup Health Now, the weekly show celebrating the healthcare transformers and change makers that are reimagining healthcare. My name is Stephen Krein.
And I'm Unity Stoakes.
And on today's episode, I'm really excited to be interviewing and speaking with one of the original healthcare transformers in startup health, Bronwyn Spira, who's the CEO of Force Therapeutics, a recovery platform for patients. This is going to be a great episode.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Welcome back to Startup Health Now. We are excited to be here with Bronwyn Spira, the CEO of Force Therapeutics, a recovery platform that's changing the landscape in the physical therapy market. Welcome to the show, Bronwyn.
Great to be here, Steve, Unity. Good to see you guys.
It's great. I mean, Bronwyn really is one of the original healthcare transformers, so it's great to have you here.
Thank you. I'm so proud of it. I tell everybody I was the inaugural class.
Yes. So one of the things that I think is so cool about you is you're a physical therapist. You've been practicing for how long? 20 years, 20 plus years?
20 plus is good.
Since she was like 6 or 7.
Amazing. And you journeyed to become an entrepreneur. What was that journey like? Why did you decide to build Force Therapeutics in the first place?
So, I spent a lot of my career helping patients in any setting, from inpatient hospitals to outpatient to home care. And I think what really struck me as I think about my body of work in the physical therapy space was just that we need our patients to do so much in between office visits at home. So much of their recovery rests on what they do at home, and yet they are not given the tools to be successful with recovery. And
what did they do in the old days? A piece of paper? Poor instructions, no real information transfer. And partially, technology has enabled that to a large degree, and I think video is a very powerful medium, and it's certainly one that we leverage a lot. But I think just even looking at how healthcare is evolving, and so much of healthcare is moving to make patients successful in the home environment and moving away from these, large institutions, hospitals, outpatient centers. And so in order for that change to happen successfully, patients need tools and need to be empowered to do well. And at the same time, as that shift happens into the home, clinicians, providers need to have a better understanding of how their patients are doing in between office visits. So you can't take everything away and just strip it bare and expect patients to recover. So that's really where I see our platform as serving this dual role, which is providing tools for patients that are engaging, digestible, understandable, and providing transparency for providers as their patients move further and further out of the hospital. Just for the audience, if you could just give a really succinct sort of what is Force Therapeutics and how does it work?
So Force is an online and mobile platform that provides tools for patients to recover from musculoskeletal injury. We are working with a lot of leading institutions, orthopedic and integrated delivery networks, to help providers get transparency into their patients' recovery process, because it's really a process, and at the same time help patients be engaged and active in their own care at home.
So I want to, now that we framed Force Therapeutics, I want to go back because I didn't get the gist of why you felt compelled as a clinician to start this. Because it's wonderful, first of all, it's incredible to have watched over the last couple of years you transform from an idea into a real startup and a company that's figured out product market fit and now scaling and have some great partners. But I want to go back to like day one or even pre-day one and how someone even goes from working in the office to actually saying, I want to actually do something about
improving
what it's like to either be a patient in a physical therapy environment or a physical therapist.
Yeah, and I think about it a lot, actually, and I think it's two main things that drove me into where I am today, potentially. The one is this real, when you're a physical therapist or any kind of clinician, you're always just thinking about your patient. It's almost a mindset. Everything you do, you're thinking about, how can I get this patient better quicker? And so that's part of it. So, when you realize that the impact you can have on thousands of patients could potentially be much greater than just this one-on-one touching, 12 patients a day, that in and of itself is kind of a motivating factor for me. And then the second piece of it, which I think most entrepreneurs will tell you, is that it's really fun to build something great. And even though this is my, first real business, I've always built things. I built 2 private practices from scratch. Even within the companies that I worked for, I worked at the Rusk Institute here at NYU Medical Center for a long time, and was really engaged in building up my department. And that's really exciting. Mentoring people, creating, making a vision real.
So you've always created things and always were entrepreneurially minded. And this just was taking it to the next level and building a separate business that can scale and have different characteristics than a private practice.
Exactly. And it wasn't ever my true intention, I don't think. It kind of just happened. I was doing this, I was still treating patients. I had my own practice when I started this business. And it was just something that I was thinking about doing on the side. I tested it in my own practice, which was a great experience and helped me really develop the product. And still today, I use it with patients, and we are very engaged with patients using the platform. So that really helps us inform our development, and I think that's really a key thing.
So you're able to be a customer and a user and
exactly.
Put it in practice. How much of your time is spent still practicing versus your role as CEO of the company?
Today, I'm mostly run force. I have a couple of patients that are long-time patients that, still.
Very cool. I think it's a trend, right? I think it's close to half of the entrepreneurs now in startup health have co-founders that are practicing clinicians, MDs, PhDs, other kinds of clinicians. Are you seeing that, both in the physical therapy kind of specialty, but others as well? And
I think it's important. I think it's key. Healthcare is complicated, and it's very hard to solve it from the outside. So if you've been in it for a long time and you understand the unique issues, it helps to solve them to some degree. I mean, some people get very stuck in their ways, and it's harder to be entrepreneurial, but I think that there are so many complexities about patient care that a clinician can uniquely understand. Mm.
So talk a bit about the journey. So you were practicing, you built these clinics and really saw these problems from your own experience, and maybe saw how technology and video could change things. How did you get started, and then how did things evolve?
When I think about the aha moment, it was when I had stepped away from my first practice that I built, and it was just after I had my first child, so that was 5 years ago, and it kind of took me. I needed to step away from being in the weeds of practicing to actually understand that there was a bigger problem to solve, and. I started thinking about what it is that patients really need to enable them to do what it was that I wanted them to do as a clinician, because I realized that the piece of paper wasn't really doing the job. So that's kind of where the seed started to grow, and at the same time is when video technology became pervasive and accessible to all, and so it just kind of built upon itself. And it started as a very simple idea, which was, we'll take these pieces of paper and replace them with beautifully filmed videos. And then we realized that as healthcare was changing, this could actually solve an even greater problem, which is, an $850 billion problem. And that is how much the U.S. healthcare system spends on musculoskeletal disease every year.
Wow.
And growing. So, thinking about how enabling patients, empowering patients to do what they need to do can actually help to take cost out of the system became very compelling. And that's when I really think we decided this really has legs. This is a real business. It's really solving a big problem.
So that's like 10x thinking, right? You're thinking about not just a practice or even a couple of practices. You're thinking about a national or global problem, and thinking about how your solution can scale to meet the needs and challenges of so many people. I think it's a different level of thinking, but it seems like that shift. It went from an aha moment to,
and starting with a couple of patients and your own problem.
And it was really a microcosm of what the greater situation could have been and now is. And, this bundled care movement, which is right in our wheelhouse, is really gaining ground now in healthcare. And our solution happens to really speak to all of those issues and answer a lot of those problems that bundled care is trying to solve.
Did someone instigate you to think bigger, or to think about expanding, or the applicability of expanding your idea and to hit more people, or was it just inherent?
No, I think Mark, my co-founder, Mark Lieberman, also my husband,
your partner
in all things, is himself a multiple entrepreneur and has big visions, and it's interesting because his skill sets are so complementary to mine and totally different, and yet for some reason they just kind of round out the picture. And him having this experience in business, healthcare, media space really helped me to keep thinking big, and he was really encouraging of this vision. But why should it only be in physical therapy? Why should we only do orthopedics? So I think that this evolution is definitely a big contributing factor with our partnership.
Talk a little bit about how you finally found product market fit within, moving this from a practice and deploying the product there to actually, a much larger set of customers and partners, and kind of how you finally figured out. It seems like really a very unique way of explaining what you do and what your goal is to improve as many lives as possible.
So it's been an interesting journey. We started off in my comfort zone, which is physical therapy. I built a product that I thought would be perfect for physical therapy practices because they could be more efficient and they could think about, how to get patients better faster, which is all we think about all day long. And very quickly came to the realization that disruption is not necessarily welcomed in a lot of business situations.
By practitioners, by the industry,
So today we're very still stuck in fee-for-service, especially in the physical therapy industry. So actually the product that I was bringing to these therapists was ultimately cannibalizing their business. And
so they were threatened by what you were offering.
Yes, absolutely.
And I think a lot of entrepreneurs face that problem today, which is they're not thinking about or talking about how it impacts somebody's pocket.
Absolutely.
And therefore
there's winners and losers. The surprise to me was, I'm a physical therapist. I don't think it's threatening. Like, why are these people so afraid? But I do get it, actually. This is their bread and butter. This is all they know. It's all they do. And so we thought a lot about it. And at the same time as we were getting a lot of pushback from physical therapists, and there are certainly a bunch of very forward-thinking physical therapists that are using the platform today, that are thinking about how to deliver care in this new healthcare landscape. And so I'm not talking across the board here, but it is a very fragmented industry. So a lot of these mom and pop shops are really just reliant on how many visits they can see in a day. And of course, I think all of that is changing, and we at Startup Health think that healthcare is changing for the better. But this is a very hard thing for an individual clinician to see.
So did you have to go door by door and knocking on doors?
We started off that way. And then we had a big shift in our thinking, and we thought about it very long and hard and thought, who is really quarterbacking this change? Who are the people that are really going to win by enabling this shift to the home? And in a bundled care situation, it's really the orthopedic surgeons that are quarterbacking this whole change, and they are the ones that are probably going to be 99% of the time controlling the bundle, which means that for them, they need to find creative ways to manage costs.
Explain the bundle, because
Sure.
I think it's important, especially for people who are just getting up to speed on some of the changes that are coming with the Affordable Care Act and some of the new ways that and lingo people are using.
Okay, so the way that the Affordable Care Act dictates we now look at care, instead of each service provided having a fee attached to it, that's fee for service, we're now moving to an episode of care basis, which means that if you have a total knee replacement from pre-surgery to full recovery, there's one payment, a bundled payment, that covers all those individual services throughout the course of that patient's care. And so when we looked at those episode payments, we realized that 41% of the total episode cost was in the post-acute care phase.
So that's where you want to
that means
shift.
not surgery, not anesthesiology, not hospital fees, not medication, post-acute care. So that's physical therapy, rehab, radiology, follow-up visits. So we thought about that and thought, well, in these kind of episodes of care, is that much really warranted if you have a suitable replacement? So what we did was we tried to encapsulate the rehab experience on video as much as we can. And what does that mean? Education, exercise videos, how to avoid infection, how to recognize a DVT. And we put all of that into a package that we now deliver to a patient once they've had surgery. So that patient can access this resource 24/7 on their mobile phone or their computer. And in doing so, we've reduced, a good amount of costs.
And you're getting to the patient through the orthopedic surgeon.
So the patient's using your service, and then who's paying for your service?
So the orthopedic surgery centers, the hospitals are paying for access to the platform. There is a one-time per patient fee, and we have not had pushback on that because the patients realize that even by saving one copay, they're still winning. And they have this...
Plus they don't need to drive into the clinic every day or every week. They can do it in the comfort of their own home?
Yes. They can do it in the comfort of their own home, and they're always connected to their healthcare provider team. So we have a very strong communication portal where a patient can post a question, any member of their care team can answer that question in real time. And a lot of the resources are already there for
I was just
them.
going to say, I'm assuming once people answer some questions, they go into a library to access
Correct.
for the future.
So, one of our key performance indicators, KPIs, which I'm sure you guys all know about, is to reduce call volume to doctors' offices. Because one of the things we hear when we talk to care teams, and that's surgeons, nurses, PAs, you name it, medical assistants, one of their biggest complaints is, I get 45 calls a day from patients asking me the same question over and over again. So we started thinking about that and thought, well, that's not a good use of time. You're a busy clinician. Why do you want to say the same thing 40? So we made a video of it. And so now it lives in the patient's Force platform. And anytime they access their platform, and it's all very personalized and individualized. So if you have a shoulder replacement, you're going to get a different set of, we call it FAQ videos, than if you have a knee replacement.
And you can bring that to every customer. That's not separate, different video by customer, is it?
We do custom content. We do create custom content, but by now we have a pretty extensive library. So, I call it, PT 101. Certainly joint replacements are covered in there. But as we branch into more and more aspects of healthcare, like cardiac recovery, neurosurgical recovery we're doing next, you name it, we continue to bolster our library, create content along with our partners.
So big shift in even the last couple of years is you're now kind of well entrenched into this Affordable Care Act impact, the impact of the Affordable Care Act,
Yes.
and we talk a lot about how it's a treasure trove of opportunities for entrepreneurs. It seems like now, as you kind of found that product market fit, and you were just describing kind of your target customer, it's very clear who you're calling on and who you need to kind of bring in. It's not the physical therapist anymore, which was who you were calling on in the beginning. And now it's the the orthopedic surgeons, the surgery centers and clinics. When you think about patients who want to just come direct to you, is there still an option for them?
We have a lightweight consumer app called Force Injury Packs that is basically a flight of care that we created along with the best orthopedic surgeons, physical therapists, sports injury doctors. And it's kind of a one-stop shop. It gives advice to patients if you've sprained your ankle, ice or heat. It tells you what exercises you should be doing and what you shouldn't be doing, which in physical therapy is often the most important thing you can tell your patients. And then it tracks your recovery for you, or allows you to set goals and track your recovery against those goals. So it's kind of standalone. It doesn't have the provider engaged, but it is just a consumer solution for those who want to self-solve minor injuries.
So when you look out 3, 4, 5 years, what does Force look like in terms of its user base? Is it mostly going to be through the providers and less so directly from the patients?
Yeah, I think, right now we're focused on top of the pyramid healthcare systems. And so we're working with a lot of orthopedic surgery centers, as well as integrated delivery networks, which are very interesting to us because they are the payer as well. I think that our next evolution is
Do you think that more holistic approach is more efficient, smarter way to go?
They certainly understand the benefit of a system like Force because there are more stakeholders that win. Mm-hmm. When we think about who benefits from our platform, it's always the patient first, and then probably, the provider second, but certainly the payer is, they're the ones that are really benefiting as well. So with an integrated delivery network, they are their own payer, so they're seeing that value today. And I think that will permeate. I do see Force as landing in the payer's pocket at some point, where they're picking up the per patient fee. Mm.
I love how, even though your customer is not necessarily the patient, the paying customer, you're still very patient-centric, both voice and product, and you keep talking about the value creation engine here and how everybody benefits, but it keeps coming back to seeming like you're very, very insanely focused on patient value.
Yeah,
well, I'm curious about that in terms of technology, because when you're introducing new technology to your patients, what was that process like, and how did they adopt the new technology?
So, that is a great question, and one that we think about all day long. And so we've come to this place now where we understand that technology can be scary. You can't just dump a technology solution on a patient, a hospital, a provider. Healthcare is still personal for patients and for providers. So we really needed a bridge that helped people engage with our technology, understand the value, and a little bit of hand-holding. So we created a department within our company called Patient Success. And that department's key, goal in life is to make our patients successful with Force, and providers too. So what we do now is we spend a lot of time understanding a provider's workflow within the hospital, who is responsible for discharge planning, who's communicating to the patient, so that we can make sure that the message is the same. And then our patient success team calls the patient prior to surgery, gets them logged in, makes sure they can log in, see their exercises, in a lot of cases practice their exercises before surgery, and then take a lot of the anxiety out of the process. Because one thing that we found with a lot of patients is that anxiety about recovery is all about not knowing what to expect. So we use our patient success team to really set expectations. Here's what it's going to look like once you've finished your surgery. You're going to be discharged 1 or maybe 2 days post-surgery, which is a very different thing to what a lot of patients expect. They expect they're having their knee replaced, they're going to be in hospital for 2 weeks.
Right.
And that's no longer
So you're making
the way
it less
works.
intimidating and educating them as the...
By providing them that information. So we really feel that because healthcare is so personal and because we're dealing with people and not things, we have to bring in this human element. And so we do work one-on-one with patients still. In a lightweight way, we don't take on clinical questions or anything like that, but we just want to make them successful with our technology.
So what are so you talk about KPIs, the key performance indicators. What are let's talk about the traction and how some of this is working and how you're viewing success in, monthly, quarterly increments.
Great. So a couple of our the things that we look at are around patient engagement. And I think patient engagement is this term that's getting thrown around a lot. It's like a buzzword. And so before talking about patient engagement, we think about what that is and what it means for us. So for us, it means that patients log in daily for a long period of time.
Because you want to see they're doing their exercises and doing their routine.
I mean, our goal is to make it like brushing your teeth, do it twice a day without fail. So we measure and monitor how many times patients log in and how long they stay on the platform.
And you report that back to your customers.
Absolutely.
So there's an analytics component.
There's a big analytics component, and we're actually working on creating a proprietary algorithm that will help us understand what an activated patient looks like, because activated patients, which is patients that are engaged and active in their care, are more successful patients. They recover better, they recover faster, and they have fewer readmissions. So that's really what we're looking at when we think about KPIs for patients. So today we have a very high, about an 84% engagement rate for people. 84% of patients are logging in, and our average length of engagement is 9.5 weeks.
Right, so you are able to bring that and talk about that average with each customer and where their benchmarks might want to be or should be or could be.
And
correct?
Because this is all Brave New World, there are no baseline metrics.
So you're giving them the baseline metrics.
So we're actually, in a lot of cases, developing and educating our provider organizations on best practices and what they should be looking at.
Yeah, so the data plays a huge role.
Huge.
Yeah, I mean, every company...
It's interesting because you got a mobile platform. This is a home healthcare solution, and there's a big data analytics component to what you're doing.
Yes, and there's a big piece of data that nobody's actually collecting, which is patient-reported outcomes. And we are collecting that today from patients at a very regular interval so that we can report back to providers how their patients are doing and also get an understanding of who needs intervention. What does a patient look like that needs more intervention, and what does a patient look like who needs no intervention? So
what kind of numbers are you talking about? How many? Do you talk publicly about how many patients are using the platform, or how many doctors or how many practices are?
We have thousands of patients on the platform at this time, and I'd say hundreds of providers. We have different kinds of providers. We have physical therapists on the platform, the forward-thinking ones. We have orthopedic surgeons and their care teams, and then we also have integrated delivery providers that are using the platform. So those are 3 big buckets, and it's exponential because each of those has their own group of patients. And
so paint a picture of the future and where this goes a few years out from now or 5 years out from now. What's the vision and what happens?
Well, I think my goal would be that FORCE is the standard of care for post-acute recovery. And so I would like to see it, pervasive in every orthopedic diagnosis. I think that our opportunity is actually to collect data on protocols that are successful. So if providers need to understand what's working and what isn't. We house all of that data, and we house it from patient-reported outcome measures, pain scales, time to recovery. So all our key metrics will help us to understand what is a successful recovery look like, as well as which patients are at risk for readmissions. And I think that once we get critical mass, we'll be able to disseminate that information in a very useful way. And we really, globally, we want to change how healthcare is delivered in this country. We want to take a bunch of cost out of the system. We want to help patients recover faster and better. And we want to make the whole process much more seamless and less scary for patients.
Love it, love it. I want to segue from that into a little bit about your lifestyle, right? Because how you manage and juggle all of these, being the mom, working with your husband, still practicing, being CEO, and taking on an enormous challenge and building an exponentially growing company that has clearly a huge opportunity in front of it. What are some of your daily habits and things that you do to kind of juggle or prioritize and triage kind of each of the things that are kind of, tugging at you?
It is a daily challenge, but it's a great challenge to have. I mean, each of these things feeds me so well. Being with my kids is just the best gift life can give. Working with my husband is amazing, and we often wonder to each other, how would we do this if we weren't married? Because you can just imagine what our dinner table conversation is like 9 times out of 10. And it's not in a way that is oppressive, because we are so excited about this company that it's just
more
fun to talk about it,
Cool.
So that's a big piece of it. And then I think I have such an amazing team. And it's taken us a while to find the right people, but I can say that every single member of my team is a rock star. And I don't think we could do what we do without them being, each of them is just exceptionally passionate about what they do. They believe in the vision. They see it on a day-to-day basis. They can see every day how they're impacting people's lives. And I think, job satisfaction right there. And they really bring their energy and their passion to work every single day.
So how many people do you have on your team now?
So I have 12 full-time people right now, and then we have a couple of kind of part-time. We have a production crew that we hire when we're doing filming and editing and that kind of thing, but we keep most of it in-house, and our technology is in-house, and that's been a great thing for us.
What was that transition like, focusing on working with patients and then building technology?
It's funny. I had a moment there where I was like, this doesn't feel right. But then once it started to click and I saw what the product could deliver, it just felt like I was doing what I've always done, helping people get better. Right. So, the transition was there, but it's ended up in the same place.
Yeah.
So thinking back and looking back, I should say, and if you were to talk to yourself 3 years ago when you were starting the company and you wish you would have known something that you know now, what would it be, and maybe some of the advice that you'd give to healthcare transformers, either current or future healthcare transformers who are thinking about jumping in? What would you have told yourself?
I would tell people to be confident that what they believe to be true is true. And it's so easy in the early days to doubt yourself, to doubt your vision, to doubt your process. And you will make mistakes. I mean, we made tons of mistakes along the way, but at the same time, those mistakes have brought us to this place, So, and it's all just been following that vision of helping the patients and reinventing healthcare. So you just have to keep, your eye on that the whole time.
Believe. And how has it been for you? You surrounded yourselves with lots of other entrepreneurs. I know you've got a great advisory board. We've had the opportunity to work with you for a long time. How has that been to have other peers around you, a peer network of other people building in the sector?
I think that in a way that can help you not give up, because what we're doing with healthcare, and I say we collectively here, is hard. We really are reinventing an entire industry. And knowing that other people have that belief and that vision just helps you, move forward and press forward. And, you guys have been so instrumental in guiding us as a company, and I see how you work with other companies. And I would say, if I were to look back again, I would say that a lot of times the advice or the learnings that you shared and our other healthcare transformers shared is also valuable, but it didn't have any meaning at that time. And yet there are days now, later on in the process, when I can think back and say, I remember having this discussion at one of our, summits, roundtable summits, and and it all comes full circle somehow. So I think, you just have to be a sponge, absorb everything, stuff that you can't use right now, you put away somewhere, but it's there so you can access it later.
Yeah, it's one of the reasons. I mean, the long-term nature of startup health is specifically because it's going to take a long time for us to as an army of entrepreneurs transform healthcare. But I loved how you just articulated you weren't ready for the message at the time, but then you recalled it at the right time, and so it's all being absorbed, and you're kind of immersed in that peer network. And I know you've leveraged that peer network a lot. To help you build the company. So any last words you'd like to, kind of leave us with as we, wrap up? I really am impressed with what you and Mark have been able to do with your team. We've watched you navigate, a lot of obstacles, and you've done it with grace, and it's been really wonderful to have been a part of and participated in that. So I'm very excited for you. But any last words you'd like to leave healthcare transformers with, or entrepreneurs with, or anyone listening?
Other practitioners maybe thinking of becoming an entrepreneur.
Or moms who are thinking about becoming entrepreneurs.
Listen, I think life can be so rich when you're doing fulfilling work. And, if you think about what you're doing as having a huge impact, not only on one patient at a time, but the entire United States healthcare system, you're doing good work. Keep it up.
Fantastic. Awesome. And where can people find more information about Force?
ForceTherapeutics.com.
Fantastic. And can they go in the App Store and download the app?
They can download the app on iTunes or Android. Force Injury Packs is the consumer app. And if you're a patient, you get your own special app.
Love it. Love it. Well, thank you so much for spending the time. It's such a pleasure working with you. And thank you. And thank you for joining us for the latest episode of Startup Health Now. You can find all episodes now on iTunes and our YouTube channel at startuphealth.com/now.
Have a good day.
Take care.